First, by reviewing video in which enhanced the dissection plane or autonomic nerves, the surgeon can understand why and where they entered the wrong place. So I think it is more effectively by reviewing AI-enhanced video than compared with the original one. And I think it also makes it easier to compare the dissection with expert surgeons, and they can recognize how different the exposure of the correct plane can be. This is also my own impression from reviewing many of AI-enhanced surgical videos. Second, real-time AI analysis is now available. Although the clinical value still needed to be evaluated. In the future, AI could allow the surgeon when the dissection field is too close to the autonomic nerves. Such a system could encourage the surgeon to improve the exposure and maintain a safer, more appropriate dissection plane. So regarding the competency assessment, Japan currently has a technical certification system for surgeons. At present, the evaluation is very subjectively assessed by reviewers. If AI could objectively evaluate the surgical mobilization and dissection quality, it could add more objectively to this system. In addition, AI may be useful in initial screening tool to technical assessment, probably leads to reduce the burden of human reviewers.